Hey guys, in this week's video we are talking about ADHD. We're going to learn about ADHD symptoms, we're going to talk about ADHD signs, the causes, and what to do if you think you might have ADHD. So let's begin. So welcome to my channel. If you haven't been here before, we talk about everything medical and healthcare related, and as always, we always look at the evidence so you know you can trust the information that we're giving here. Also, please remember everything in this video is going to be chaptered in the description below, so if you want to find any specific info, click on the description, click on the chapter and find that information that you want. However, I would always recommend that you watch the entire video. That way you're going to become a bit of an ADHD pro and know everything about it. Also, if you do find anything helpful in this week's video, or if you find and learn something new, please don't forget to click that like button because it's going to help me, it's going to help the video grow, and it's going to help the video grow to a much larger audience so more people can find it. Okay, so let's begin with the basics. First of all, what is ADHD? ADHD stands for Attention Deficit Hyperactivity Disorder, and it's a neurodevelopment disorder that can affect someone's ability to learn, their behaviour and their memory function. And so it can be split into two main branches of symptoms, one being inattentiveness and the other being hyperactivity. Now, inattentive symptoms include being distracted easily or having a short attention span and being unable to follow instructions to complete tasks, and as a result being unable to complete tasks. Now, whereas hyperactive symptoms include being unable to sit still, always fidgeting, constantly fidgeting, also excessive talking and acting without thinking. Now, it's important to remember that with ADHD, some people may have a mixture of these two types of symptoms, or they might have one type, but it's also important to remember that there are many incorrect stereotypes about people with ADHD. For example, people may think it only applies to hyperactive boys in a classroom, but this is wrong. Now, you see, with that kind of stereotype, it's only one representation of a condition that can affect people so differently. We've just spoke about a few of the symptoms, and as you can see, people are affected very differently with ADHD, so it's not just that one stereotype that a lot of people are aware of. And as a result of this, a lot of people are underdiagnosed with ADHD and they just learn to cope with it during their childhood and adolescence and are lately diagnosed, so they're diagnosed quite late in their life, as in whilst they're an adult. So what I'm trying to say with all this is that it doesn't mean that it's gone away when they become an adult person. They've just learned to cope with it. They've just learned to deal with it. So in this video, we're going to talk about all the kinds of symptoms and what to do about it. Okay, so now that we've spoken a little about ADHD, let's move on to those ADHD symptoms and ADHD signs. Okay, so when it comes to healthcare professionals, we use something called the DSM-5 criteria to diagnosing ADHD. This really helps us to come to an understanding whether a patient has ADHD or not. It's not the only tool that healthcare professionals use, but it can be very helpful in aiding the healthcare professionals. So, the DSM-5 criteria, these are the kind of symptoms we're going to talk about for inattentive symptoms that we spoke about earlier. Please remember, if the person is 17 years or older, they need 5 of these symptoms to be diagnosed with ADHD. Or if they are 16 or under, they need 6 of these symptoms. Okay, so what I don't want to do now is ramble about each symptom because I feel like it's going to get confusing. So the best way that I thought to do this is to have a little box here. These are the symptoms from the DSM-5 criteria that you need to be aware of for the inattentive symptoms that we spoke about. So remember, it's 5 or more if you're 17 or older, and 6 or more if you're 16 years old or younger, okay? So have a read through them, pause the video now, read through them, see if any of them apply to you. Okay, so now that we're done with the inattentive symptoms of ADHD, let's look at the hyperactive symptoms of ADHD and what we use to diagnose that. So again, we're going to use the DSM-5 criteria again. Like I said to you, it's not the only tool that healthcare professionals have to their disposal, but it's a really good one to help them, okay? So it's the exact same principles that we just spoke about, the exact same apply for this one as well. So if you're 17 or older, you need 5 or more of these symptoms, or if you're 16 or younger, you need 6 or more. So there'll be a box here that's popped up probably by now. Have a read through each one, see if any of them apply to you, take your time, click the pause on the video, give it a read. Okay, so with all these symptoms, I guess with all of us, we can link ourselves to any of them, but please remember this. These symptoms need to have been ongoing. It can't just be a random few times that it's happened. It has to have been ongoing. Also, these symptoms should have existed before the age of 12 as well, okay? These are the kind of things that we need to look at when you're using the DSM-5 criteria. So they need to have been there since the age of 12. Before the age of 12, you need to have had these symptoms. They should have been ongoing. Also, you need to make sure that these symptoms are happening in different locations as well. So for example, if you're struggling to follow instructions, let's say on the inattentive symptoms, this needs to happen both at work, for example, and at home. So these are two different settings. Now please remember that sometimes it can be extra difficult to diagnose ADHD because these symptoms can be shared with other conditions as well. For example, bipolar, mood disorders, and loads of other conditions can share similar symptoms. So it can be very tricky. And to make things even more complicated, ADHD can sometimes happen alongside other conditions as well, like for example depression, anxiety, Tourette's, autism, so it can be very, very difficult to diagnose. So the moral of the story is, you know the DSM-5 criteria, you know the signs to look out for. Please don't try and self-diagnose because you won't be able to self-diagnose. You need to speak to a healthcare professional about it if you think you're having these kinds of symptoms. We are going to talk about when to seek medical attention a bit later on, but I just thought I'd say this little bit here now so that you are aware of this as well. Okay, so I hope you're finding this information helpful so far. Please remember, if you found any of this video helpful so far, any of it has been new, don't forget to click that like button. Like I said, it's going to help me and it's going to help the video grow, so it's going to be available to more and more people. Now let's talk about the cause of ADHD. Look, the cause of ADHD, most likely it's believed that you're born with it, it's a neurodevelopment disorder, but the actual science and reasoning behind why it actually happens is actually quite unknown still. Some studies have also shown that the underlying cause of ADHD could be due to a lack of certain brain chemicals or neurotransmitters known as dopamine, but more research is needed still. And some research suggests possible factors that increase the risk of ADHD include being born prematurely, a low birth weight, alcohol and tobacco use during pregnancy, or exposure to environmental risks like lead during pregnancy or birth. But unlike many misconceptions, there is no evidence to suggest that sugary foods or bad parenting can cause ADHD, so please do remember that. And also, the symptoms of ADHD in children can be worse if they're from turbulent families, let's say, however, compared to a more stable family, of course. But like I say, there's no real evidence that these are the cause of ADHD. And lastly, the same goes for diet too. There's no evidence that certain foods can cause ADHD. The most important thing is that you're having a healthy, balanced diet. So obviously, if you do have children, that you're feeding them well, feeding them a healthy, balanced diet instead of processed foods. However, they don't cause ADHD. There's been no link associated with it. This is just general lifestyle advice that everyone should be following. So moving on to the next section, what should you do if you think you have ADHD? If you're someone who thinks they have ADHD, you need to speak to your healthcare professional. Remember, when we spoke about the DSM-5 criteria, I mentioned to you that it's very complicated diagnosing ADHD because it can sometimes run parallel to other conditions and the symptoms are very similar to other conditions as well. So it's super important that you speak to your healthcare professionals so then they can ask you questions, take a full history, take a full family history, and if it's actually required, refer you on to the psychiatry team so they can take interventions and take a history and make the diagnosis. A psychiatry referral will be required to make the diagnosis of ADHD. Now, if you think you or your child may have ADHD, it's very important to speak to your GP, and this is especially if you feel symptoms are affecting your daily life. So for example, affecting your family relationships or ability at school or work. It's also super important to speak to your doctor because if you could benefit from treatments such as medication or therapy, it could change your life for the better, making daily tasks less of a struggle for you. Now, please do remember as well that treatment doesn't always have to be medication. There's also psychoeducation and cognitive behavioral therapy, all of which are proven to be very helpful. Now, the reason why treatment is so important for ADHD is that unfortunately there has been a lot of stereotypes about ADHD where it's just someone who fidgets a lot, that just struggles to do tasks and is hyperactive. But unfortunately, as we've learned in this video, ADHD is far more complex than that, and there has been evidence to suggest that people who suffer with ADHD who are not treated in the long term have much higher suicidal rates, and as well as that, they are much more prone to being in car accidents as well. So I'm going to say this one last time, if you do feel like you have any of the symptoms that we spoke about in the DSM-5 criteria, you now know everything about it, or if you feel like your child has any of these symptoms, please, please, please speak to a healthcare professional. That is the most important thing, because your health is the most important thing. So it looks like we've come to the end of this week's video. I really do hope that you found this information helpful. Like I said, there are so many misinformation, stereotypes out there about ADHD, and like I said, being this condition of just hyperactivity, but it's far more complex than that. So I really do hope that you find this information helpful. And as I always say at the end of each week's video, always remember you're awesome, and I will see you next week. And also, I can't remember the last one. Now inattentive, now. Now inattentive, now. Okay, and bad, but. Hey guys, thanks for watching this week's video. Make sure to click that like, follow, or subscribe button now to stay up to date with new weekly videos.